Diabetes, obesity, and cardiovascular disease are very strongly linked. In fact, we know that a person who is obese with a body mass index above 35 kilograms per meter squared will have a 90-fold higher risk of developing diabetes than someone with a body mass index of less than 25. It's also well known that, in fact, diabetic people have a 2 to 4-fold higher risk of cardiovascular disease. And in fact, the person with diabetes has a cardiovascular age 15 years older than their actual age. However, it's not all bad news. We know that if someone actually embarks on a healthy lifestyle, adjusts and modifies, that they can reduce this cardiovascular risk. Once we determine that someone is diabetic, the treatment goal is to delay, prevent any development of complications. Hemoglobin A1C is the surrogate by which clinicians decide that the person has good glucose control. Patients with diabetes are not all homogeneous. They come in different sizes and shapes. They come at different ages. You have young and old, you have slim and overweight and obese individuals, uncomplicated versus complicated patients. So therefore, the targets at which we aim for in these individuals have to be individualized for that individual, for that person. In this module, we hope to assist you in deciding which therapies are best for the patient in front of you. You will learn how to decide which therapies are best for different types of patients. In particular, we will provide practical guidance to select therapeutic agents depending on the type of patient that you are managing. This will include patients who are intolerant to metformin or perhaps have contraindications to metformin use, as well as patients who may be vulnerable to having or developing hypoglycemia. In addition, there's also going to be practical guidance to decide depending on whether the patient has established cardiovascular disease or not, as well as whether the patient has got diabetic kidney disease or not. So this practical guidance will take you through certain details in order to assist in clinical decision-making for your patients that you are managing.